So we're here at HMI, Hyperbaric Medical International, and we figured what a great place to do a few more research
reviews.
overviews. So this conference is a total medical hyperbaric oxygen conference, primarily talking about using hyperbaric medicine for treatment of neurologic conditions, particularly TBI and concussion, and happens to be relating a lot to vets here. So they brought in a bunch of vets to talk about some of their exposures, while they were serving, and what their responses to hyperbaric medicine was in terms of healing. And so we wanted to do a quick research review on neuroplasticity. So this was done in Israel. Researcher Shai Fradi, who's basically in a lot of ways heading a lot of this neurologic research. They're able to do things outside the U.S. that sometimes we struggle to get funding for in the U.S. So they're helping prove a lot of what we already know is out there and working. So that was a great study.
So this one's really neat because it's actually showing great results neurologically, even after a chunk of time post the event. So in this study, 74 patients that had suffered a stroke 6 to 36 months prior to the research. So they had been suffering these effects for a long time. It used to be thought that if you had a neurological event and you didn't get access to hyperbaric right away, that you would not benefit. They've now proven something called the penumbra effect, which basically means these cells just go into almost like a hibernation and we can wake them back up. So in this, the 74 patients had at least one motor dysfunction. Sorry, it's a little loud here. They were assessed via SPECT imaging, neurologic functions, activities of daily living, and quality of life. They went through 40 hyperbaric sessions at 2 atmospheres and 100% oxygen. Every single person in the treated group had elevated brain activity as confirmed by CT, and regions of noticeable changes in anatomy and physiology from the imaging. The results indicate that HBOT can lead to significant neurological improvements in post-stroke patients, even at chronic late stages. So this is huge. We didn't know in the past for quite a while that you could actually have impacts post-event.
So I think, like most things, research is catching up to clinical experience.
What we see.
So we've been doing hyperbaric oxygen in our clinic for over 12 years. We've treated tons of post-stroke patients, even as late as 10 or 12 years post-stroke. And these patients still, even then, see really, really massive changes in their
cognition, living,
sight, spasticity, all those things are still able to change. And here we have some research that's starting to prove it. So
fantastic. Thank you, Dr.